Hello everyone, welcome back to Metal. We have with us today Dr. LOCHAN, who has managed to get an amazing rank of 49 in NEET PG 2022 and INICET rank of 717 amidst a lot of uncertainties, which included rural service, postponements, COVID, and he managed to get within rank 50 while balancing both his studies and a job. And recently, rural service notification has been given for the next batch of interns as well, and they are also in the same situation that he was in like 1 year ago. So we would want to know how he managed all the things and how he managed to remain sane in all of these phases during the preparation. So hello, Dr. Lochan. First of all, congratulations on this amazing rank. And thank you so much for agreeing to do this video with us.
Thank
Please
you, my
introduce.
Indian channel, for allowing me to express my views regarding this and helping me to guide my juniors.
Can you please introduce yourself and let us know where you are from, where you did your MBBS, and where you did your rural service as well?
Good afternoon, everyone. I am Dr. Lochan Geji. I am from Belgavi and I have done my UG from Belgavi Institute of Medical Sciences. And I have done my rural service from here only, that is BIMS.
Okay.
Through counseling, I have got it here.
What was your plan if there was no rural service? Like, obviously, if you wanted to study, you would have wanted to take a drop, or you wanted to actually work somewhere, or what was the plan?
My plan, if there was a no rural service, was I was going to join Bhartiya's offline coaching
Okay.
by staying somewhere in Bengaluru, by
Hmm.
staying in a PG
Hmm.
and studying there from 8 to 12, as they had
Hmm.
told, by
Hmm.
booking their library. That's what every one of us, we were planning that way. We preferred offline because everyone knew that online lectures aren't that helpful
Hmm.
as compared to offline. So my plan was to go to offline center of Bhatia in Bangalore and study there.
Uh,
Rural service came, we had to change that.
So, what was your first thought when this notification came, and how did that upset you? Or were you able to manage your studies in that time, or you couldn't do anything at all? It took away most of your time.
Okay, actually, what happened was most of us, the 2015 batch, we finished our internship somewhere around February or March. Most of the colleges in Karnataka, they finished their internship by March.
Mm.
And that time only the court case was going on about rural service. Again, everyone was living in uncertainty.
Mm.
But at least we were focused that because our seniors didn't get the rural service, so we'll not get.
Mm.
And I think by the end of March, there was a confirmation that rural service won't happen.
Mm.
So everyone started studying seriously in their homes,
Mm.
and everyone started thinking of going to Bhatia by booking their offline centers. But the thing, I think the notification came on June 21.
Mm.
Till then, everyone was studying and everyone had planned their whole year perfectly and everyone was set. But then came the bomb that changed all of our lives. I think that was a very uncertain time. I don't think anyone could study that time
Mm.
because most of them were studying seriously. They had put their timetables up. Everything was set. Some guys had shifted to Bangalore also.
Mm.
So everyone was in shackles.
Mm.
No one was expecting that we'll have that rural service. But then we were bombarded with links that we have to go here, we have to put and upload our documents and put our choices for counseling. Like that 1 week, I didn't study at all. To be honest, I didn't study at all because I was very anxious that where will I get, first of all, whether I'll be able to study during that time. Like most of us were thinking, I think after working this again, we have to drop for a year
Mm.
and then study seriously for NEET. But then after the counseling happened, then we started getting to know that being a JR is a bit different than being an intern, because all we had experienced was internship by that time.
Right.
So we were a bit senior, so we could go back earlier. But still, there was a time where we were that was a time where we were wasting some time in hospital. Yeah, we were getting some of us were getting paid for it, but we didn't ask for it. So yeah, no one studied. Not I don't think anyone was studying until they got set until they were able to set up to that JR ship, to their departments.
That is
About my
yeah.
okay, ma'am, continue.
No, I think the juniors are also in the same phase right now, and there are a lot of uncertainties if they will be posted or not. What stage of your preparation were you in when this notification was released?
I think I was just starting my preparation, just completing my subjects one by one.
Okay.
I still remember I was doing my, I think, anatomy while the notification had come up, and because of that I couldn't study anatomy at all. I had to study anatomy after 2 or 3 months later. So I need to tell the juniors that everyone's lives are filled with uncertainty. So what you have in your hands is you have to plan day by day. I don't think you need to plan for a month. Plan for the next day, plan for tomorrow. Don't plan for the next 15 days, 20 days. Don't plan like that. Plan like what you'll do today, what you'll do tomorrow. Just the today and the tomorrow. I don't think you should plan for or 15 days or a month. That's what the thing is. Till the notification comes, I don't think you can make a timetable for a month or so. So I would like to tell them to try to study as much as possible in this time of uncertainty. Whatever you study, I don't feel that it is not useful. It will be useful. You will have completed some amount of subjects before you start the counseling or before you start your JRship, and I think the people who have completed most of their portion before JRship, they will be at an advantage, because they'll be not losing much time there in completing. They'll be directly going on to revision. So I would like to advise them to study now, or leave aside the notification. As and when the counseling comes, go and attend it. Attend the counseling with a peace mind. Don't be anxious. Just try. Even if you are anxious, don't be scared and don't be afraid that it will affect your rank in a very big way. See, if you are attending counseling, many of your colleagues are also attending counseling. They are your competitors. So even your competitors are facing the same anxiety. So everyone is at the same thing and everyone is at the same level. So don't be anxious. Everything will go fine by the end of it.
What are the
everyone
things?
will get a rank and everyone will go and join a PG institute. So everyone is facing the same thing. That's what I want to say.
What are the things that they should keep in mind when they're putting the option entry for rural postings? Like, are there some departments which are less hectic, or if they have the choice, should they put certain options about the
departments? I think both the medical colleges and the PHCs and CHCs have their pros and cons. If you join a medical college, you will have a lot of people around you. You can at least tell them that you have to study and you can go back. But I don't think any medical college is so supportive to leave us to study the whole time. Most of them are not supportive. As they have hired you, they want you to work there. So you have to be cautious. You have to ask your seniors, whoever have done there, whether it is whether they are okay with us being as JRs and still studying. So in a way, non-academic or non-clinical things, non-clinical departments are better because their schedule is fixed. It is a 9 to 4 job. You can, if you are a person who wants to make a perfect timetable, and who wants to have a perfect time to study, then I think you should prefer non-clinical departments. But yeah, but the cons of non-clinical department is you have to be there from 9 to 4. But the pro of the same thing of clinical department, they have an advantage that every day you have to work, but you will be working only during the rounds time, because as you are not an intern now, you can come back after telling whatever duties you have about collecting blood investigations, all that, to the interns, and you can come back now, or to your seniors like PGs, you can tell them and come back, but you have to inquire your seniors whether they were able to do that or not. So
that is one
non-clinical
advantage. One batch of seniors that is
at least we have faced that thing. So you can ask your seniors your that wherever you want to go, you can ask the seniors who have done there, and you can inquire them whether they are letting us go early or not, whether they are letting us study or they want us to be there till the whole duty hours, whatever you have to ask them. As far as I know, non-clinical departments everywhere in Karnataka, they have their fixed schedule from 9 to 4. So that is a good thing about non-clinical departments. But as far as I've heard, not every medical college have GRship in non-clinical departments. And good thing about PHCs is if your CMO or RMO, whoever it is, if your senior there is good, then he'll let you study. He'll not even make you come there. But if he is bad, then he'll make you stay there for a whole time.
So they have to find out, even with respect to PHCs, they have to find out before going, because I have heard that some of the PHCs were very toxic and they expected, they put all the work
they
on
expected
them
us to be there.
So, okay.
What? And one more thing, I think it's better if you prefer your hometown, because if you go somewhere else, you have to book a home, you have to look out for your food, clothes and all. I think it's better if you just stay near your hometown, because at least you'll be having home where your mom or dad will cook for you or manage foods and all for you, food and clothes for you. So I think that thing will be sorted in that way. Then if you want to stay in a hostel and be away from family problems and all that, then you can choose. Like, it is a personal thing. Like, it is personal choice where you want to go. But yeah, in GRship, I would like to tell you, non-clinical and clinical, you decide that and ask your seniors about how the job there is, so that they'll guide you better.
Okay, so you took up biochemistry department in Pelagavi Institute. What was your time like? How was the work there? Was it like hectic? And were there days where you couldn't study or you couldn't do anything at all? And how do you manage on such days?
Actually, I started my GRship in June 30. We all started at June 30. Beginning there, as the counseling was, nobody knew how to do the counseling between us students. So there was like uncertainty for about 1 month. They was deciding how to do the counseling on the basis of what. So till then I was posted randomly in ENT, radio departments like that. But after that, when I was posted in biochemistry, as it is expected, everyone is not welcoming at the beginning. They don't want us to study, they want their work to be done. So in the beginning, they were posting us in the lab, biochemistry lab in the hospital. So there we couldn't study because of all patients coming and asking us reports and all. So again, there were days when we couldn't study at all. Specifically, I couldn't study at all, because even if you go for an hour or two to the hospital, you get tired. So that was the thing. So I used to get tired from going to the hospital in biochem department. So some days were there when I couldn't study. It was for at least 1 or 2 months, where even I was not sure of the schedule of the lab or of the biochem department. But once I got set there, I got to know how they are working. Then I could find out a way to study. When they were not there, I used to come back to the study room there and then study there. So that's how it was. You have to work out a schedule according to your department. So there will be days when no one could study. There will be days. So I think that day you just have to stay calm. You can't be anxious that because of this one day I lose a whole lot of thing. I'll be behind my preparation. I'll not do. I think my exam is gone. I don't think that the whole thing about this preparation is being positive
Right.
and being a bit confident. In being confident in uncertain times needs strength. So that's what we need to have in this preparation.
So coming to your actual preparation, when did you start preparing? Were you attending any classes in third year or fourth year, or did you use any online platforms in your UG days?
Actually, I bought Marrow in final year.
Okay.
For my final year subjects only, because in BIMS they were not teaching us final year subjects well theoretically, but clinics were good. But theoretically, theory classes were not happening that well. So that's why I had chosen Marrow to study for my final prof. But then I found it very useful during preparation because I had a set of notes which was already prepared.
Okay.
But again, in internship, I couldn't prepare because BIMS has a very hectic internship. So actually, to say, I started my preparation after internship in March.
But you already had the notes for the major subjects in like the
three major subjects.
Okay.
Yeah.
Okay. So you didn't
three major
prepare...
subjects, that is medicine, surgery, and OBG.
Okay. Okay. How was your internship and like internship as such is like clinical, and the exams have also become clinical right now. How useful was the internship experience for your exams, like solving MCQs?
I think it was very much useful because these exams are becoming more and more clinical as we are progressing through the years, because they are trying to tell us the point that internship is important. They are pointing to us that internship, whatever you learn, whatever the skills you learn in internship, whatever the procedures you learn in internship, whatever the instruments you use in internship are important. They are not asking us a very deep instruments, like what, in which surgery which instrument is used. They are not asking us like that. They are asking more about which color of cannula is used in this procedure, like in trauma, which color cannula is used. So our exams are mostly focused on a perspective of an intern treating the patient. So that I think internship experience helped a lot. But there are aspects that because it was hectic, I couldn't study on. I couldn't focus on subjects like first year and second year subjects, because there was no point of studying them at that point. So I think in a way it is good and in a way it is bad. So we have to go with whatever situation we have in hand. But I think the internship experience helped me in a way, because clinical scenarios, I was able to judge them well. I knew what first treatment we give in hospital. So in a way it is helpful. Internship experience is helpful. And as this next comes up, I think it is going to be more impactful. Yeah.
So how was your UG days, like MBBS days? Were you involved in any other extracurricular activities or hobbies? And did you manage to do other things also, or were you a topper, or always used to like enjoy studying and use standard textbooks? Tell us about your MBBS journey for 5.5 years.
Okay. I think for the first year, I was a topper. Like I was in top 5.
Okay.
I had scored distinction by 75.2%. But then it was all a downward spiral. I think whole of the MBBS journey, we were more focused towards taking trips, doing a lot of masti and all that. But for the first year I didn't use any standard textbook, because all that I used all the textbooks which our seniors told us. Same BD Chaurasia, for physio this GK Pal or Sembulingam, and for the and physio AKJN also, and biochemistry Satyanarayan.
Okay.
But
But
only in, I think, in second year I used Robbins.
okay.
Except that I use the same textbooks which other students also used to use. Except Robbins, in my whole MBBS journey, I have not touched any standard textbook. I had bought a Harrison, like, but I
Okay.
didn't. I wasn't able to read it. I
Okay.
got scared just by looking at the volume of the chapters there. So I, at the end, I had to go back to Manipal manual, that I don't know, Mantappa, I think that's what they call it. I studied it from there. So I think all our MBBS journey was that I studied from only one standard textbook, that is Robbins. That's all.
Okay. So
So I
for
don't
all,
think that is much important, but
huh,
as people say, standard textbook will help you build a good base. So if you are a person who likes to study from the beginning, who wants to build their base and concepts correct, then standard textbooks are good. But it's okay if you are not studying that. It will not make a much big difference at the end, because the ones who study at the end, they will clear the exam and they will do well.
Okay,
That's
so
what I
for
feel.
all the juniors who are watching this, it's not like we are saying that you shouldn't study standard textbooks.
Study,
but
yeah. If you can grasp the English well, you can go with them, because they are good. They are good for a reason, because foreign authors, like authors who are much more experienced, who have done research studies, are publishing them and are writing them. So they are not writing this just as a joke. So I think it is standard textbook are standard for a reason, because they are to the point and they are very true to the clinical content or clinical things what all are happening, and they are very true to the research and whatever new things are coming up in our field. So
But
if you can grasp, you can study with standard textbooks, or it's okay if you can study, if you are studying with some other book, it's fine. As far as you are studying, it is okay. If you're not studying, then you have to study. You have to clear at least your final exams.
Yeah, if there is someone who is watching, like just as a summary, if they have not touched the standard textbooks, you can still manage to get an amazing rank.
You can, yeah.
So you shouldn't be worried about it. But if you can go for standard textbooks, like to build your confidence. So next, what were the sources for your preparation? Did you stick to one source, or there are so many things right now that people are like they take so much time in deciding what to choose. So how did you decide on your source, and how did you use it?
Actually, I stick to only one source, that is Marrow.
Okay.
Only because I had bought Marrow during my final year. I didn't there was a dilemma what to choose. Should I choose Marrow? When I was starting my preparation in March, there was a dilemma whether I should choose Marrow or Bhatia or Prep Ladder. Prep Ladder is concise. Bhatia has good teachers. I know all our juniors will be going through the same thing, but I want them to know whichever platform you feel comfortable will get you a rank. No platform has promised that only because of their teaching, the toppers have secured that rank. It is toppers have secured that rank because they have studied, not because they have studied from that source. I think source will not hold much importance. The only thing which is important is how you study that, and whether it is easy to study or not. So I think in this preparation, we need concise things. So I would like to tell my juniors to go towards sources which provide concise topics or concise books which we can read and revise faster, because revision matters the most in this. So in this preparation, so choose a source which is easy to read, which is easy to understand, which is easy to revise. Most importantly, which you can revise faster. That's what I would like to recommend. But then I stick to Marrow because I had no option, because I had studied from Marrow in my final year. So because I had a set of notes, so I thought they would be better. But for ones who have already taken Marrow and who are having second thoughts, if you want, you can change that. It's not that I'm telling because you have done because you have started from Marrow, you have to go to stick to Marrow only. But in this preparation phase, stick to only one source. Don't keep on changing your sources. I started my preparation with Marrow and I stick to it. I always felt like okay, Bhatia में teachers अच्छे हैं और Bhatia ने teachers छनागीदार है, so I should go there. Or Prep Ladder has much more good rapid revision videos, so I should go there. They will every source has a pros and cons to it. So stick to your source. Make your own notes as much as possible. If you have printed notes, it is fine. If you can read them, highlight important topics. More important thing about preparation is revision. So make notes or buy notes which are concise. Focus on that instead of choosing source and being anxious. I'm losing out on that good teacher, or I'm losing out on some rapid revision thing, or I'm losing out on certain small things. They will not matter. All that will matter is your revision and the speed with which you will revise that thing. Because the thing which matters is you should be able to revise your whole portion in the last 1 month or 1 month 15 days or the last 45 days. You should be able to revise that portion which you have. So that's how you should make your notes, and that's how you should choose your source if you want to have a criteria to choose a source.
Did you give NEET, the previous NEET, like NEET 2021? If you did, what was your rank and how did you change your strategy after that?
I had given my NEET PG 2021, which was in September. I secured a rank of I think 6,100.
Okay.
6,100. So after that, the thing was I was not prepared because I didn't give my 100% in that exam. I hadn't completed all my subjects. I wasn't done with not even one revision. I hadn't even completed one complete reading of the syllabus. So I think that's why I thought of giving another attempt. That's because I was feeling that my attempt was incomplete. I didn't give my 100%. So only thing which I changed during that after the exam was I got to know that I scored a rank of 6,000. So somewhere I was going in a right track. So I thought that if I increase the number of times the revision I have, the more I revise, the more better rank I could get. So I think that's what. After that we had INI-CET November also. So till then, after I think September, October and November, 3 months time was there. So till then I had completed one reading of my portions. So that's why I scored a rank of 2,000 in INI-CET November. And after that I focused only on revising. Then I was planning my revision, how many times I should revise, and what things I should focus on, what things are not important. Like no one can tell you what important topics are. You will get to know by once you complete your reading, and once you give a GT, you will get to know by that.
You said that you already got a rank of 6,000 in previous NEET, and that is a decent rank. Were you like in a dilemma to like whether you should take a drop, or what happens if you take a drop, and what if the next exam doesn't go as planned? How was your mindset at that time? Like, and was there any pressure from parents or family to take up the seat at 6,000 rank?
To be honest, I still remember my dad was telling me that you should take up a seat whatever you get through this rank only, because there is no guarantee that you will perform like this. I know you are okay, you are decent, you study well, you are studying, but this exam is like that. This exam is uncertain. We can't predict what will happen. We can't predict how much rank we'll get. So I think the same thing whole of my family was telling me that you should take up pediatrics. You'll be getting a good pediatric seat in this rank. At least you will be getting it in KIMS or I think MMC if you try to go till mop up.
Mm.
But
Mm.
I was telling my family that I don't want pediatrics.
Mm.
The main thing I was telling them that I didn't give this attempt
Best.
with a full heart. I have
Mm.
not given this after preparing for a year, or I have
Mm.
not given this attempt. I have not totally given my mind to this exam.
Mm. Mm.
Uh, so I want to give another attempt just because I have not completed my portion. If you want to say that it is by luck, yes, this exam, NEET PG 2021 rank was by luck, I think. But the rank which I have got in NEET PG 2022, I have worked for it.
Work.
Yeah, there is a lot of luck factor in it, but
Mm.
at least I had given my 100% there. I didn't feel that I didn't feel that I had given 100% there in that exam. So that's
Mm.
how I convinced them. But I had to attend I had to attend counseling and Karnataka counseling to convince them that I'm not getting a good college for general medicine in GM.
Huh. Mm.
So after that, they got convinced, and after showing them some of my GT scores,
Okay.
they were convinced. Okay, you can get a rank better than this, not a
Huh.
very good rank. You will be getting a rank less than 5,000 at
Huh.
least. So after that, they were convinced. But convincing parents is tough because they'll be having some expectations out of
Mm.
you. But at the end, they are your parents. They only care about you. So if you tell them that honestly that all the things which are going in your mind, they'll tell you the way to work it out, and they'll tell their opinion about it. I'm not telling they'll be always correct, but at least you can convey them what you are going through.
Right.
That's the main important thing about it. There is no use of hiding thing or avoiding them about it. You have to tell them at the end because they are your parents. They'll get to know about it at the end. So yeah, it is better that we convey them whatever is going on in our mind and tell them clearly that this is our plan. Then even they, I think no parent will tell them that I'll not support you. They'll always support their child. So even though my parents were telling that we should take, but after I told them that I want to give my 100% in the next attempt, they started supporting me, and then they told, okay, you can give them another attempt. Even if you get a worse rank, it's okay. We'll help you with that also.
Mm. So that support
But
and your confidence is all that matters. So if someone is there
yeah,
who wants to take a drop, this is what you need to keep in mind,
yeah,
that
yeah.
you should have the confidence
It's
and
okay.
the support
Since that
continue.
you should feel that you have given your 100% in that attempt. You should feel that after this attempt, I can't study anymore.
Mm.
That's the limit where you have to reach. If you have reached that limit and you can't study, then I advise you not to take a drop.
Mm.
If you have studied to your heart's content, if you are feeling that, yes, I have studied everything that is possible and I have revised 4 or 5 times, or I have revised so much that I feel that I can remember, but I couldn't do well on the exam day. If you want to give another attempt, you can give, but you just have to think that if you can make a difference in that attempt,
Mm.
if you can make a difference in the next exam, that's what you can think, and then you can take a drop.